Turning back to this now, we have to talk about it. An outbreak of pediatric pneumonia cases in Ohio is causing major concern nationwide, with parents wondering whether these illnesses are linked to a surge of similar cases they're seeing in China. So far in Warren County, Ohio, over 140 pediatric cases of what's being called white lung syndrome have been reported, and that number only expected to rise. Now, according to health officials in that county, this does not look like a new virus, instead a large increase in pneumonia cases normally seen this time of year. Still, the number of children infected with pneumonia is surging in several parts of the world, including the Netherlands and China, where hospitals are overwhelmed with cases. For more on this, we want to bring in Dr. Kristin Englund, infectious disease specialist at the Cleveland Clinic. Dr. Englund, thanks for hopping on with us this morning.
Good morning. Thank you.
Yes, a happy Friday. We appreciate your time. You know, in some parts of the world, it's certainly a chilling echo of the early days of COVID with overwhelmed hospitals, especially in places like China. But take us behind the scenes of this surge in pediatric pneumonia in your state. Can you tell us more about what you've been seeing and also how concerned you are about it?
Well, we're certainly seeing a number of, as you mentioned, a number of different countries starting to see these rises in cases of pediatric pneumonia. But what we're not seeing is the evidence that this is a new pathogen. What this seems to be is a very common bacteria that we see year after year called Mycoplasma pneumonia. So this is something that we see surges of every 3 to 4 years, and it just seems to be the right time for us to have a surge here. Plus, as we're coming out of times when everybody was masking and following a lot of protocols with hand washing, we were not seeing cases of mycoplasma. They're going to be on the rise again now.
I was going to ask you that very question. You know, do you think the outbreak that we're seeing here at home is connected to those that we're seeing in other parts of the world? Or is this just what happens when people are under pandemic lockdown for years and kids' immune systems aren't what they should be?
Definitely think it's the latter. I think we're just simply seeing the effect of the lockdown and coming out of the lockdown in many different places across the world. There was a study from an international network group that just was published last week in Lancet Microbe, and they clearly tied it into the difference in Mycoplasma pneumonia from other, say, viruses that we saw rising last year, because viruses replicate much more quickly and spread so much more easily. Mycoplasma doesn't do that, so its spread is going to be a lot slower.
And Dr. Englund, I know there are people watching at home right now saying, why is it called white lung syndrome? What's the answer there?
Well, it causes a pneumonia, and unlike some bacteria where we get one certain part of the lung that is affected, like a strep pneumonia, this is more of the walking pneumonia, where it affects a lot of different parts, areas of the lung, less intensely than say if you get one part of the lung affected. But it's clearly a walking pneumonia, so you're not necessarily hospitalized if you're an older child or an adult.
Yeah, all that white popping up on scans, too, I'm sure. Also, right now, Ohio health officials are investigating what's triggering the wave of infections. I know the World Health Organization has also made an official request to China for more on its spike in illnesses. As an infectious disease specialist yourself, what information are you hoping to glean from these inquiries?
Well, certainly if we can get any kind of specific bacterial information or viral information. I mean, we know that we're seeing RSV rising at this time of year and influenza as well. So again, there's no indication that this is a new pathogen. It seems to be just a confluence of a number of different viruses and bacterial infections. So I think getting specific data about what their microbiology is actually looking like there. You know, I think if this was something that was a new pathogen, we wouldn't see it involving just a specific group like children. We'd be seeing it involving all ages. And I think it's the children that have never seen mycoplasma before that are most at risk.
Yeah, and just lastly, while I have you, speaking to those families who are watching this morning who are concerned and wondering, okay, as a mom or as a dad, you know, what should I do to protect my littles? What do you tell families who are worried, especially in this cold and flu season?
Yeah. So I think the lessons that we learned over the last number of years really kept us from having cases of influenza and RSV and mycoplasma pneumonia. So just teaching your children the importance of covering their cough, using a Kleenex or coughing into their elbows, making sure that if they're sick, keep them home so that they're not getting other children infected. And unfortunately, as we start coming into the holidays, if you're sick, you might have to start skipping those family and friends events.
Yeah.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.